First of all, thank you for having me on the educational working group for ACIH. My predecessor, Ezra Cohen, was on this, and I knew of the group, and I actually came to one or two of the meetings previously, and I apologize for the last meeting. I was actually on it, but I had a really bad connection to it. I was in DC at the time. But one of the things that, obviously as Assistant Dean of Chiropractic Medicine, kind of the program director for NUHS, is working with the curriculum and what that actually means. So I was previously in the University of South Florida PhD program for higher education, and I had to actually leave that program to come here to Lombard, and so I'm going to enter another doctorate program for education. But one of the things that we studied is obviously curriculum and what that means. But first of all, I wanted to show what I look like. When we see each other, you can see what I look like and say hi. And this is me a few years ago, and then our students at DC 2017, whereas a combination of research and legislative action for the chiropractic medicine profession, me with my family, getting my master's, and then obviously sometimes I do poster presentations. And so this topic I actually presented in Montreal from some of the studies that I did in my PhD program at University of South Florida. And so again, this is very basic information, but I think it may help all of us to kind of think about it is, especially with our program and our institutions, what does curriculum mean? What does the word curriculum mean? What does it mean in our program, but also what does it mean with integrative health education? Where do we want to go from here? Very basic question, but very important question to ask. Obviously, when that question was first posed to me, I thought of the list of courses, the lectures, the actual labs, the small group, the discussions that we would have, the kind of list of structured classes and descriptions that we have. Is that our definition of curriculum here? Or is it the dynamics of the class? We always think of flipped classroom, or we have a learner-based curriculum. Is that needed in our curriculum? Is our curriculum set up that we can actually do that? Excuse me. And so, I don't think particularly that we actually need that all the time, but I think we do need dynamics in our classroom. Classroom technology, do we have that, or do we need that in our classroom, and to what extent do we need that? Is that part of the curriculum? With the dynamics in the class, do we actually consider that part of the curriculum? There's a good book called Teaching Naked by Jose Bowen. I'm not sure if anyone has heard of that author, but he's actually writes extensively about actually taking computers out of the classroom and bringing back more of a discussion within the classroom and how that actually enhances student learning. And then also co-curricular activities. A lot of times we see this as kind of a separate thing from the curriculum. Is it extracurricular? Is it co-curricular beside the curriculum? Or can it actually be part of the curriculum? We're doing a co-curricular initiative right now with National University of Health Sciences and seeing that we're having all these activities with the students, but then we have to tie it back into our program outcomes and our curriculum and our competencies that we have for the students. And so it's great that we have these activities, but we really have to tie it back to the students also. But the question comes about, is this considered part of the curriculum too? And so my point is that one of the four that I have, is the term curriculum has many meanings and significances depending on the patient or the participant in higher education. And so if we go around the table here, we probably will come up with 8 or 9 definitions of the word curriculum. And sometimes that's actually needed between the programs and between the professions that we have. However, we have to probably come up with some common ground also. So some stable definition of curriculum would assist active players within the program, between the schools, and also interdisciplinary for policymaking and for legislation. I think that would bring strength to the table to have a stable definition. And so one of the solutions is to conceptualize curriculum as actually an academic plan. And so this will identify critical decision points that will enhance student learning and enhance the experience of the students. And so we may be also familiar with L.D. Fink wrote a book called Creating Significant Learning Experiences. That's really our end point or end outcome, is really to increase student learning and student success, and to do that to create these significant learning experiences for the student. And so to do that, I'll show you the diagram for academic plans here in a second, but academic plans involve certain elements. We have the purpose and mission really of the program and the institution, content, and after writing this with my poster in Montreal, I would put /competency also. I think content and competency are equally important with that, and I think sometimes we struggle with that. Sequence, learners, and instructional process, but also we need to think about what are our resources with our institution. We just discussed that about, do we have those resources for education and research within our institution, or, maybe we need to link up with other institutions to enhance that too. But probably the most important part is making sure that we're always evaluating and adjusting our curriculum. And, what cycle do we do that? Do we do that yearly? Do we do that every 2 years? Do we break up our curriculum and look at certain aspects of our curriculum differently? But especially for I think all of our professions, and especially what I see with my profession with chiropractic medicine, we need to look at the social cultural context and influences. What's the external and the internal influences? And we'll see the diagram in a minute here that I made off of the text that we studied. But one thing that is missing off of that diagram is patient and public health. That's one of the influences I think really should be key for our curriculum too. And so the text that I'm really basing this off of, this is actually a good resource. Beth H. talked about maybe a good research for curriculum, maybe not so much for assessment, for going back and looking back on the curriculum, is Lutuka and Stark's Shaping the College Curriculum. It really talks about academic plans and how we can go back and maybe evaluate academic plans in kind of a holistic way. And so I made this diagram adapted by Lutuka and Stark's diagram that they actually used in the text, and applied it specifically for my profession of chiropractic medicine. However, we can all absolutely do this for integrative health too. And just listing off things that I've already mentioned with the academic plan, we need to be privy of the purpose and the mission of the institution, the content, what's our resources for or within our institution. How do we want to treat the learners, and what's going to be the effective sequence of our curriculum also, but what kind of experiences do we want to have within the classroom too? I think that's equally important within the curriculum. And again, we want to give liberty to the faculty of actually doing that, but again, we want to give guidance and training for certain things that are actually proven within the literature that have worked very well. And obviously we want to assess and evaluate that and make adjustments. We've talked about student evaluations and what's the structure of actually making adjustments to our curriculum within that educational environment. But I think equally important is the social cultural context. We have our own educational processes within our institutions, if it's trimesters, if it's quarters, and what are maybe some pros and cons to that. But we also need to be privy of some of the external influences and internal influences. So, we're getting ready to have site visits for a council, should be of chiropractic education. and also obeying regional accreditation. But then we need to look into those two accreditations as seeing there's requirements there, but how do we grow above and beyond those requirements for the programmatic and regional accreditations too. And then obviously internal influences, we should be looking back to the mission of our institution. What's the scope of our institution? What's the purpose of that? And making sure that we are following that too. And then equally important is training for our instructors. Maybe they're from another discipline and we need to do some development there too. And again, one thing that I did not put on there was a patient and public health. And I think that, especially for my profession, should be one of the leading things that guides the curriculum, seeing what's the demand for patient and public health. And so just going quickly here, what are the things, while I was doing this kind of literary search, what are the things that we can maybe conclude and discuss here is the goal of the academic plan, where we're putting it in this framework. And again, we've all thought about this framework, or the contents of this framework, but it's really organizing it in kind of a diagram like that. Is the goal of the academic plan, specifically I did it with chiropractic education, is to identify critical decision points that's going to increase student success. That's our main outcome that we want to have, obviously, with competencies usually. Academic plans imply a deliberate planning process and focuses attention on important educational considerations and opportunities within our profession. And specifically with chiropractic medicine, I think there's a lot of opportunities, but if we are organized and if we have a plan, we can have many projects and many opportunities that we can have within our own profession also. Academic plans also help with focus, clarity, especially when we put in perspective the social cultural content within our profession, and increases awareness of what we should be doing and how do we actually speak to policymakers and legislation. And then academic plans will help to separate facilitation and constraints that we may have. A lot of times we confuse these constraints with facilitators. A lot of times we think, well, we may have to work with another discipline and that's going to be a constraint. In actuality, it's actually a facilitator within our profession. And then 5, finally, is utilizing academic plans in our profession may offer a dynamic view of curriculum development, and that it may help us make our program not as stagnant, but more progressive and growth-oriented. However, we need to still make sure that we are doing assessment and adjustment to the curriculum, making sure that we're meeting these competencies within the program. So. But that's my time. This is a picture of me teaching way back, well, not way back then, but about 3 or 4 years ago. But thank you very much for allowing me to do a presentation and me being on this working group. And if you have any questions, I'm free to entertain those. And I'll stop sharing right now. There you go.
Very nice. Thank you so much.
Yeah, very good. Thank you, Chris. Appreciate that. Questions, comments from the group?
And I can send the presentation and my poster that I did in Montreal if there's any questions or anything of that.
Yeah,
sort.
that'd be great. Is it okay if I post both your this recording of the presentation and what you send on our website?
Absolutely. Please do.
Okay.